So I'm here with Susan Voss, who is the president of the National Association of Insurance Commissioners. So give me a general sense of what a state exchange is and how it works.
The law is very flexible on what a state exchange can encompass, but I think it's safe to say that the idea of a gathering point where consumers can get information on all the healthcare programs that are available to them or could be available to them, including whether they are eligible, is what we're all tasked with doing. That's sort of the general overview. Now, how you want to do your exchange, if you want it to be as much as a purchasing exchange where actually the exchange would accept money and help purchase that coverage, or as more informational exchange that does provide for eligibility services plus tax subsidies, I think there's a wide gamut given the rules and regulations we've seen so far. So states have a lot of flexibility.
Okay. And as of now, what are the benefits?
I see two benefits, regardless of what way you go in your operation. Number one is we're going to have a much better Medicaid eligibility system. I think it's probably safe to say that most states have pretty antiquated or cobbled together systems. Technology is, not a high priority often, and so we know that Medicaid eligibility system needs to really be brought into the 20th century, let alone the 21st. Mm-hmm. The second thing is a gathering point where consumers can get a lot of good information. I think one of the struggles of consumers has been they don't really know what's out there in the market. They may get information from one source, but they don't have multiple sources. We're going to set up an exchange. We already actually have one in Iowa with information where they know every carrier that's selling, the average rates, what's included, who's in their provider network, what's the different products that are available. And so I think you're going to see people have, well, we hope, better educated about what's out there and is available to them, and can be better purchasers if they're actually doing it on their own.
Okay, so now let's talk about some of the challenges. What are the possible challenges that may present when you're trying to implement a state exchange?
I think the cost. The law says that we have to have it self-sustaining by, I think it's 2015-16. And I think that is a challenge that a lot of states are trying to determine. How do we pay for this? Do we charge people every time they get into the exchange? Do we assess people? I think there's a real concern about how is this going to be self-sustaining. I think the second one is once you go in a certain path, whether it's a purchasing or an informational, is it going to be utilized appropriately? And I think third, and we're all kind of watching, is what's happening with the United States Supreme Court. Are we going to go down a path of putting this together and then other pieces of the Health Care Reform Act may become unconstitutional, and how does that affect the overall exchange?
Okay, so if they're going into effect in 2014, some states are implementing them sooner. Mm-hmm. So how does that kind of affect the employers?
Well, we're going to have to do a lot of education to employers. I think if that's the way they're going to purchase through the exchange, if the model you have is that they must go through the exchange or they want to, I think there's a lot of education, because many small employers, they only purchase one product. Now, if you give small employers the ability to purchase through multiple plans, I think those are multiple issues for small employers. And I think that's something we really, at least I can speak from experience in Iowa, we've not really addressed that yet. We are still in the process of figuring out what kind of an exchange we're going to have. And I think that's where a lot of states are. So the whole talk about a shop, the small employer option, is a lot of heavy lifting left to do for consumers.
Now, let's talk about the role of an agent going forward.
Yeah, under the new federal law, there are pretty strict requirements about what's considered part of the medical loss ratio. And this is affecting agent commissions, because now they must be part of the administrative costs, which has been limited under the federal law. And what I think the fear is, not just for the agent community, but I think for consumers as well, what happens to the role of agents as a facilitator of purchasing, and also as a facilitator for assisting on questions about your health care costs, your claims processes. The NAIC took a position based on the federal law that the agent commissions had to be part of the administrative costs. And that has caused insurance companies to renegotiate their commission costs to agents, in many instances lower than they are currently. And there is a real concern by the agent community that, of course, they're going to lose income. But also, how does that affect consumers? We know that a major portion of the small employers purchase their health insurance through agents. And if there are fewer agents, there may be fewer possibilities for small employers to get good information. And so we're trying to balance, we're still in discussions, trying to balance how do we keep the agent engaged, because we know they provide a valuable service, especially to small employers, yet giving them adequate compensation for the work they do, because we know in many instances their role with the employer doesn't just end at the time of sale. Many employers go back and talk to them about concerns they have about claim payments, deductibles, services, and we know that historically small employers don't stay with the same insurance carrier for more than a few years at a time. So they're constantly in contact with their agent about what's a better product for the population of my employer group. And we need to find a way to keep those agents involved.